Hi, this is Julie Lubinsky. I am web manager for the Christopher and Dana Reeve Foundation. I'd like to thank you all for joining us for today's chat with Nurse Linda. I want to tell you a little bit about her. Nurse Linda, she's a leader, teacher, and provider of rehabilitation nursing for over 30 years. And in fact, Nurse Linda worked closely with Christopher Reeve on his recovery and has been advocating for the Reeve Foundation ever since. She's in our online community every Wednesday evening answering your questions that you've left for her and also posting new information about paralysis-related healthcare topics every Monday. So please make sure you log on to our online community and see what she's writing about that week. But I want to thank you all for joining us today, and I'm going to turn it over to Linda. Hi, Linda.
Hello, Julie, and welcome everyone to the webinar. It's nice to see some familiar names on the list of attendees. If you have any questions at any time, please feel free to go ahead and ask them. They do not necessarily have to be about our topic, but our topic today that we'll start off with is about infections, and I've written a lot about that this month because it seems like there's a lot of questions and concerns coming up in the community about it. You know, we think, oh, somebody has an infection. That's pretty clear cut to understand. The signs of infection are redness, maybe feeling warmth at the site of the infection, and swelling. And those are really kind of the classical symptoms of infection, but sometimes it's a little more difficult to tell when you have an infection after you've had a spinal cord injury, and there's some complications that go along with that. They're the same really for everyone, but people with spinal cord injury are a bit more susceptible to infection, and the reason for this is because the spine, and after you've had a spinal cord injury, the nervous system becomes immediately after the injury, the nervous system wants to protect itself because it recognizes that it has a problem. And so in correcting itself and protecting itself from more damage, the body sends a lot of fluid, and a lot of the body resources go to the site of where the injury is to protect it, to cushion it. So there's a lot of fluid. You know, if you have an injury, you'll see some swelling there. Well, the swelling can occur within the spinal cord also, which is a good thing to protect it after an injury. But in the meantime, that also can cause more damage because the swelling is present. So what happens is to protect itself, to bring in more fluid, the white blood cells that you traditionally fight off infection become less in the spinal cord. That's immediately. And then it takes a while for that to build back up, and sometimes it doesn't build back up into regular levels again. In addition, once somebody has a spinal cord injury, oftentimes they're given steroids. Usually it's methylprednisolone, which is a steroid that's given to reduce this swelling in the spinal cord. And so when that swelling gets reduced, then the steroid is then present in the spinal cord, which leads to more infections. So why do we do that? Well, number one is to protect the spinal cord. So you want to get the swelling controlled because the spinal cord is contained in those vertebrae, just as the brain is controlled in your head, and there's only room for what needs to be in there. There's not room for anything extra like fluid from swelling. So steroids are given to reduce that, which makes people more at risk for infection. And anybody who gets a steroid, if you have a foot problem, or sometimes people have hip problems, joint problems, and they'll take steroids, they'll have like a body rash or something that, irregardless, even if they don't have a spinal cord injury, people take steroids, and one of the complications of steroids is that your immune system drops down. But because your immune system drops down in your nervous system, which is in your spinal cord, you kind of have a double whammy. So people who have spinal cord injury are at risk for infection more so than the general population. So these are kind of things that we just need to keep in mind. So why do we provide medications that might puts you at more risk for infection? Well, in all medications, we look at the benefits and the risk prior to giving any medication. And so the benefit is so great to reduce the further damage of increasing your spinal cord injury, so that people want to stop that from happening. So the steroid is given. The risk is that you could possibly have an increased chance for infection, and we know people with spinal cord injury do. So the benefit is really great. The risk at the time of giving the medication is very small at that particular point in time. But we also know that if somebody gets an infection, we have antibiotics which can treat the infection. So infections that are caught early are easier to be treated, and so that's why those are given. So what can you do to help yourself to prevent from having infection? Well, the number one thing to do is to wash your hands frequently, and this is just standard practice. This is something that we've known for years, and this is something that people have done for years, and we know very conclusively that just the simple act of washing your hands in warm water with soap and water, and that friction of rubbing your hands together, that tends to eliminate a lot of bacteria and germs on your hands. Your hands then, frequently we use our hands, we rub our eyes or we touch our mouth or nose, and if our hands are not clean, bacteria enter through those orifices on our face. So that's why we want to keep our hands really clean. So we know we can eliminate a lot of infection just by washing an area. If you get a cut, you need to wash it with warm soap and water to clean out any debris or bacteria that might be in there. The other thing that we can do that really helps avoid infection is exercise. And I know I've been talking a lot about exercise a lot lately, but it's just so critically important that people participate in exercise. There's more and more research that's abounding about exercise and reducing our chances of getting cancer and all kinds of medical problems that anybody could possibly get. For people who have a spinal cord injury and their bodies are not very mobile, exercise is very important because it allows the body to move in some fashion. So if you're exercising, if you're moving your arms, or if you're having somebody move your arms, if you're rolling from side to side, if you're exercising your legs or having someone move your legs for you, it's very helpful, because what happens is the body gets that stimulation where the fluid that maybe is collecting in your lungs or the urine that's collecting in your bladder has the opportunity to be shaken up a little bit. So when that fluid gets shaken up, it allow time for bacteria to clump together to become infectious. And so that's why it's so important to exercise, because the more that we're moving, the less opportunity we have for bacteria to multiply in those places where we know that bacteria collects the most, and that's in the lungs and in the bladder. We know that lung infections, respiratory infections, a cold, a cough, any of those kind of bacterial types of things, we know that those collect, and we know that bacteria collects in the bladder. We want to do our bladder emptying with very clean technique, but sometimes the bacteria gets in there. If we take enough fluids, then we can flush that bacteria out, and if we exercise, we don't give it enough time to collect and become a problem. So there is a question that fits right in here, and it says, can a small cut on my foot allow an infection causing cellulitis? Well, most definitely. So if you get a small cut on your foot, it doesn't matter if the cut is small or large. There's always a chance for bacteria to get in there. So you have to think, how did I get this cut? Sometimes we get a blister on our foot, or sometimes we stub our toe and something cuts. You can even have a callus on the bottom of your foot. that's dried skin that just keeps drying, and eventually a callus will crack open and create a cut on the foot. Even though you didn't bump into or do anything, it's just that dry skin tends to crack open. You want your skin to be moist and elastic, so you don't want to build up any kind of dry skin on your hands or feet especially. But so if you get a cut on your foot, that gives bacteria a chance to get in. And bacteria can come from a variety of things. We think of bacteria coming from dirt. Maybe if we were out digging in the garden and we got some dirt in our feet, or we were at the grocery store and we're pushing the cart and we know that other people have pushed the cart. Maybe they've sneezed into their hand, then they've touched the cart handle, and anything that a lot of people touch has a lot more bacteria on it just from the human nature of people touching things. So that's why we need to keep our hands particularly clean. But in any event, just the fact that we put on socks, even though they're clean, our feet sweat a little bit, and we put them in shoes maybe that we've worn the day before, so bacteria can collect on any of those surfaces, leading to any kind of an infection. So an infection can turn very easily into cellulitis, and I just did a column on cellulitis, DVT, and bone fracture because they all kind of look the same. And if your sensation is not very good, it's difficult to tell if it's an infection, as in a cellulitis, or a deep vein thrombosis, or even a bone fracture. So let's talk about that a little bit, because the question is about, can the infection cause cellulitis? And so, yes, cellulitis is infection of the cells. So a cellulitis is an infection that's local, right around that cut. You can even have a cellulitis develop that's an infection on your skin when there is no cut or open area in the skin at all. So as humans go through life, as we evolve as people and as a society, we are also evolving more bacteria with us that are becoming stronger and stronger and more resistant to killing infections. So the bacteria are becoming stronger than the antibiotics. So you could go to a gym maybe to do your exercise, or even, a therapy gym, go to therapy, or, as I said, even be in a store or be any place and touch some piece of equipment, or maybe your skin has laid on a mat that somebody has used before that wasn't properly cleaned, or even if it was cleaned, it maybe had some bacteria that's resistant to any kind of cleansing agent. And so sometimes that can seep right in through our pores. And then we have what's called antibiotic-resistant bacteria, which is much harder to treat. So if you see some redness, some swelling, if a part of your skin feels warm, if it's a small little spot or if it's a larger spot, it doesn't matter. Just look at that carefully and then think about what that could be indicating and what treatment you might need. If you have any kind of red spot on your skin, any kind of swelling, if there's something oozing from that spot, sometimes when there's a cellulitis, there's just some fluid from the body that will just like ooze out of that particular spot. It feels it's more than sweat, and it doesn't necessarily feel any different than sweat, but it'll just be a thicker preponderance of it that's coming out. So you need to see your healthcare provider if you have one of these problems, and they'll be able to diagnose if you have a cellulitis, which they can give you antibiotic treatment. If you catch it early enough, you might be able to use an antibiotic cream that just goes on the affected area, and then you don't have to take something orally that goes through your whole system. But if it is a bad enough infection, you might want some antibiotic cream on the area. You might also take an antibiotic pill, and that will help clear up that infection. So you want to keep that area, you want to be sure and wash it with soap and water. If it has an infection, all the more reason to wash it with soap and water. So some people think, oh, I have a cut, I shouldn't put any water on it because that will put more bacteria in it. No, that will actually help drain, and the soap will help drain the bacteria away from your skin. So it's important to wash it, get a treatment, and then also your healthcare will be able to look at that. Maybe they might need to do a test, and they might say, oh, no, you have a blood clot in that area. It's not an infection, so you don't need antibiotics, but you need to take some blood thinners for a while because you developed a deep vein thrombosis or blood clot, a DVT, in which you'll need to take some anticoagulant therapy until that gets cleared up. Or they might do an x-ray and they might find that you have a bone fracture that you didn't realize that you had. So all the symptoms look very much the same. So it's best if you have any kind of cellulitis problem, or you think you have an infection or a DVT or a bone fracture, to be sure and have that all checked out. So let's see, we have another question here. Does body weight affect the risk of getting an infection? Well, technically, I would have to say no. Practically, it can, because if you're having a harder time moving around, then that could certainly affect it. Because you're just not moving as much, so you're allowing more time for that infection to pool in that particular area of your body if you have it in your lungs, or especially if you have it in an infection in your bladder. Sometimes the results of being overweight can also make it more difficult for you to clean the folds in your skin, for you to be able to properly clean yourself before you're doing any kind of catheterization. The other thing that body weight, you might have increased perspiration in the folds of your skin in the part of your body above your spinal cord injury where you do sweat. Something else popped into my head about body weight, but it might be more difficult for you to move from side to side or move from place to place. And so sometimes that affects, in that regard, that could affect. The other thing to consider after spinal cord injury, if you're not moving your legs in particular, if you have a higher level injury, even if you're paraplegic and you're just not moving your legs, you need to be careful with your weight in the possible development of type 2 diabetes, because sometimes what happens is when you're not moving the long bones in your legs, you're not moving those big muscles in your thighs. And so when you're not really utilizing that area of your body, you're not metabolizing your sugar as well, because those big muscles are where a lot of that metabolism goes on, in the glutes and in the big muscles of your thighs. So being overweight can lead to diabetes, and people with diabetes tend to have more infection. So it's not a direct, but it's kind of a roundabout kind of situation where having a lot of body weight can really increase your chances for infection. Sometimes people with diabetes get infection just in their skin folds. You can't really see it, but they'll get like a red rash in skin folds, and it's kind of difficult to eradicate. You have to get some ointment to put inside those skin folds, and you need to keep those skin folds open when you're lying down or when you're sitting. So sometimes people will put a dry washcloth in between their skin folds if their abdomen is hanging over their thigh a little bit and pressing up against the skin of their thigh, or if they have any kind of skin folds with red rash, sometimes women under the breast, sometimes men under the breast too. You just fold a dry wash rag in half and place it under there. You have to keep the area immaculately clean, immaculately dry. You have to put the ointment on, but a washcloth in there will let some air circulate in between those skins so you don't have skin on skin, which will help you get rid of some of those pesky little skin infections that grow in those folds. If you have the opportunity of getting any kind of air or sunlight to that particular area, if you can sunbathe in the natural, just be sure you don't get a sunburn, but if you can let air and light and circulation get to those areas, that will help very much. We have a person with a question here, Daniel from Argentina. And Daniel, I don't think we've had anybody from Argentina before, so welcome. He has a problem of postpolio syndrome. Can I produce movements in the hands like Parkinson's? Well, for postpolio, it's a possibility. I think I'm reading your question correctly. So if that is what you are asking about, so people who have postpolio syndrome have paralysis, and polio in the original polio epidemics, which would have been years ago, people were treated with activity. And it seemed like the more activity that they got, more repetitive movement, that they recovered. Now we're having kind of a post-polio epidemic where people who had polio when they're younger recovered from it, and now that just due to the aging process, they got the recovery back, and so they were able to do things. But as they aged, they were just kind of on the edge of being able to do things, not being able to do functional types of activities. So as people are getting older, we're finding this kind of this rebound or echo wave of post-polio syndrome, where people are just not able to overcome the limitations of aging, in which they had limitations with their moving, and the combination is causing them to lose some function. So Daniel, I don't know how long ago you had the original polio, if you're just over having an initial phase of polio or if you've had polio years ago. But in any event, it seems like the treatment that is working best for that are these activity-based therapies. And so could it produce movements in the hands? Well, it could possibly produce movements in the hands, and they're having some wonderful results with that. But it's a real heavy-duty program involving a lot of pattern movement, and again, it's nice if you can be the one moving your arms and moving your hands just continuously through the range of motion, through every single joint. If you're not able to do that, you can have someone else move your extremities for you, and you will get some results from that also. So it's a lot of work. It's a lot of effort. It becomes very frustrating because you feel like you're doing it and doing it and doing it. But eventually people do seem to get some return of function back who have had polio. So you might want to try some aquatic or swimming type of therapy. If there's a place where you could go where therapists provide aquatic therapy, that is very helpful because the buoyancy of the water will help you work will reduce the gravitational pull, so it helps you be able to move your body parts easier. So very gentle movements. If you think about swimming and you're floating on the water, and the real gentle movements create buoyancy so you can float and you can gently move your arms across the water. It's a real wonderful feeling. But then when you get out into more strenuous kinds of things in the water, that water adds resistance. So you want to do very gentle kinds of things. Gentle movements, not the resistant kind, because you're just trying to get movement, not build muscle yet. So that would be a wonderful activity for you to try. And I see Kevin has his hand raised. And so I'm going to click on that, Kevin, and can you hear me? Or maybe Julie can help us.
Yes, Jolise, would you please let Kevin know how to ask a question over the phone if he's on?
Certainly. If you would like to register a question, please press star followed by the number 1 on your telephone keypad.
Oh, he's written his question in. He hears me, but I don't hear you, Kevin. But that's okay. I'll answer your question. Kevin is from Canada, and he wants to know how he keeps his core temperature to normal so he can stop sweating and freezing all the time. Oh, that's a huge issue with spinal cord injury. And so what the issue is thermoregulation is a tricky thing for people to maintain because their bodies tend to become the temperature of the surrounding environment. And thermoregulation is related to the cardiac system. So our cardiac system basically keeps our temperature regulated. There's some receptors in our neck and in our skin tells us that, oh, it's cold, so I'm going to shiver a little bit and create more heat for myself, or I'm going to sweat and cool my body down. After spinal cord injury, because of the way the nerves come out through the spinal cord, you might not have that ability to create that body temperature to normal for yourself. So about the only way to do that is to note what the temperature is around you, and to, if it's going to be very cold, to dress extremely warm for that. And then as your body temperature warms up, or if it becomes warmer outside, to put on less clothing. Now, if you go out in the cold or if you go out in the heat, your body's going to adapt to that temperature eventually. And when that happens, it's really hard to reset your internal thermostat. So sometimes the only way you can get back to feeling like a normal body temperature is to go back, is to get into bed and go to sleep, and that kind of resets the control in your brain. But the best thing to do for managing body temperature is to, just really dress for the weather. So I'm sure up in Canada it gets very, very cold. I have no doubt about that. So you're going to have to keep, even though you don't feel that the cold on your body skin, you still need to keep yourself dressed very, very warm for that, to keep the cold from getting into the core of your body. And you do that by keeping your hands and feet and your whole body warm. If your feet are out and exposed, or your hands are out and exposed, or even your head and face are going to be out and exposed. So keep everything bundled up in the cold so that you have less chance of losing body heat. In the summertime, when you go out and it's hot, even though you just have on, say, a T-shirt and shorts, you want to be careful you don't get a sunburn. But if it's in, like where I live, it gets very humid, even though it might not be hot outside, and you can tend to drain the heat right from your body, and so it's very hard to get cooled down again. Some people, if they get overheated, will put cold packs in their underarms or their groin, but you need to get to a safe place. So it's surprisingly a lot harder to keep cool in the summer than it is to keep warm in the winter, because in the winter you can always bundle up, put on blankets. Don't forget to put a blanket underneath where you're sitting on your wheelchair. So sometimes people put blankets on top, but they're on their seating device, and that can become cold very, very quickly. So you want to be sure that instead of having your coat on backwards so that your arms are in it and your coat, the back of your coat's covering the front of your body, but your back's all exposed, you want to be sure to put your coat on around your body so that you can keep that body temperature in the summer. You just have to find an air conditioned place. You can be outside for a little while, drink some fluids, bring an umbrella, sit under the shade, maybe have one of those fans with a water bottle so you can spritz yourself like at the theme parks. It's always so pleasant to go in that little spritz of water, because that will create some moisture on your body to help cool you down. But you're not going to be able to stay out all day in the sun. You're going to have to, find some air conditioning after a while. Kevin has another question, and I'm going to get down to that one. But first of all, I jumped over Todd because I saw the hand raised. So Todd, I did not forget about you. But Todd is writing in and said that he broke his left foot many years ago, and it's always swelled up a little more than the other foot. And he's had some cellulitis in that same foot twice. Anything I can do to reduce the chance of future infections? Okay, Todd, you are speaking to the right person here, because even though I don't have a spinal cord injury myself, I did break my left foot many years ago, so I do know what that feels like. And yes, I still have, let's see, I broke my foot when my daughter was 6 months old, so I always know how long ago it was. So it was 33 years ago that I broke my left foot, and it still swells 33 years later. Now, unfortunately, you know how people say, oh yeah, when my foot swells, I can tell it's going to rain, and I think, gosh, you could probably make money off of that some way with the weather forecaster. My foot swells when the sunshine is going to come out. So it doesn't swell when it's going to rain. It swells when it's going to get sunny. So kind of a little bit different. I don't know how yours does, but anyway, it's just one of those weird little things. So the best thing to do is to make sure that to keep that swelling down, because once you get that swelling in there, you have a lot more fluid in your foot, and so that's probably affecting the chances of you getting the cellulitis, because the skin is probably swollen tight there. So keeping your foot elevated, if you can keep your foot elevated at night so that it's propped up, not from the knee, but from your hip, so your whole leg is propped up, and so that your foot is higher than your heart. That will get the fluid to return back to your body in the night. If you can keep your left foot propped up during the day, now I'm sure you're probably sitting, so it's not higher than your heart. The fluid will have a hard time returning if the foot's not higher than your heart. And that's not really a position that most humans can assume when they're sitting up in a chair. Their foot can't be suspended from the ceiling like that and still get around all day. So anytime you can prop your foot up would be a good thing for you. If you use a compression stocking, and if you put it on before the fluid starts collecting. So if you put it on in the morning when you've been laying in bed and your foot is at its smallest, then put that compression stocking on, and that will help rework the fluid back up into your leg. If you don't have a compression stocking, you can do the same thing with an ACE wrap. Now you want to be sure and look at your toes periodically and make sure you want the ACE wrap to be on snug but not tight, because it still needs a little bit of room, because throughout the day, all of us, anyone, will have a little bit of swelling and a little bit less of swelling in any of their extremities. So you know, just normally through the day, you can get a little bit of extra fluid in your hand, you can get a little extra fluid in your feet and legs. And if you have a spinal cord injury and you're not activating that pumping muscle of your legs to bring that fluid back up to your heart, then it just tends to stay there. So your foot gets very swollen, it gets very tight. That gives a chance for any bacteria to kind of creep in there. You've got a lot of fluid in there. That's a place for the bacteria to grow. So that's the best thing, is to keep your foot up higher than your heart. Get rid of that cellulitis when you see it start to creep in. Wear a compression stocking or an ACE wrap. Check your toes to make sure you haven't cut off your circulation. You always wrap an ACE wrap from the farthest part of your body toward your heart. So you start the ACE wrap at your toes, and then you work it up your leg. If you need to take it up to the knee, or if you need to take it all the way up your thigh, you'll have to, assess that and be the judge for yourself. Sometimes people think, okay, I'll put an ACE wrap around my foot, and then the fluid collects just right above the ACE wrap. So they think, okay, I'll put the ACE wrap all the way up to just under my knee, and then their knee gets swollen because then the fluid collects there. So you'll have to be the judge of how high you need to go with that ACE wrap, but that would be the thing to do for that. And then we have a question from Ian, who, I am anonymous. I thought that was Ian. Sorry, I misread that. I was curious about ostomies and bladder augmentations with mitral fan-offs in quads. How was surgery and recovery? Well, again, you want to look at the benefits versus the risk. So usually for men, men will usually do something like they'll start out with intermittent cathing because the anatomy is easy for them to reach, and it's not difficult to do that. For women, the anatomy is much more difficult when you're out and about, up in a chair, and it gets very tedious to try to get back into bed. A lot of women will try to catheterize on the toilet, and they're very successful with that. If you have a higher level injury, it becomes a little bit more difficult. You'll need, a lot of help to be able to do that and the right equipment. So sometimes people turn to bladder augmentations, and particularly right now, the mitral fan-off procedure is gaining in popularity. I would say a lot of women have this particular procedure. Men don't so often have it, again, because their anatomy is just different and it's easier for them to catheterize. But what happens in the mitral fan-off is the appendix is usually used, but sometimes another organ is used, where the appendix is rerouted so that it connects from the bladder to a little hole that's made in the navel or right below the navel and the belly button. And so it creates a little tunnel where a catheter can be inserted through the navel or the belly button, and it will just go right into the bladder and drain the bladder from that route, rather than having to catheterize as a female and trying to get to a place where you can do that in a way that you can do it. So it's a real convenience. It's a real time saver. I am always concerned about people with spinal cord injury having surgery because of the respiratory system being compromised. So that's a risk. The benefit is the convenience of the mitral fan-off, and a lot of the ladies who have this procedure really love it. You want to make sure that you go to someone who's done a number of these procedures before. You might live in a town where you have a urologist who says, oh yes, I recall seeing one of these, or maybe I even did one in medical school. But you want to go to somebody who's really done a number of them before, so that you can be sure that they know exactly what they're doing. Sometimes people get involved in they have some kind of different kinds of procedures of the surgery done. So you want to go really standard with this. You have the surgeries. The question is, how was surgery? Well, surgery is like any other surgery. Now, some people will say, oh, you don't feel in this area of your body, so you don't need the pain medication. And right now there's this big alert in the popular press about taking opioids and people getting immediately addicted to them, and that is a serious problem. That would be another question in the risk category. But for people with spinal cord injury, and I do want to stress this, even though you don't feel the pain, your body still reacts to the pain. So if you have proper postoperative care, you have pain medication, even though somebody says, how's your pain? And you'll say, well, gee, it's zero. I don't feel anything. But your body still knows that that's happening. It's still that the surgery has happened. The body still knows it's been disrupted. And so the nerve fibers in that part of your body are firing. They're just not getting that message up to your brain for interpretation. So you still need to have the correct postoperative care. You need to have medication. You need to be taken care of. You need to, look at your wound and have somebody examining and make sure you don't have infection. People have their stitches removed, and, there's no medication for that. That's just a minor procedure, and that's done. So you don't need anything special there. But you just want to make sure that you have the same type of postoperative treatment that a person without spinal cord injury would have. And then recovery, of course, you have to wait a little while before you can start catheterizing through that, because you have to make sure it's all healed up in there, that the places where the appendix has been attached to the hole that's made by the inside the belly button or by the belly button, and the hole that's made into the bladder. You have to make sure that that is all healed up, and usually people will have an indwelling catheter. Well, that happens, but it's just a short period of time. And then relatively quickly you can start catheterizing using that passageway. So it does not take long at all. And I can't say that I have had anyone, I personally have had anyone who's had that surgery that was not pleased with the results. Now, I have heard of people who have not been pleased with the results, but it's usually because somebody tried maybe a little something different. I heard of somebody once who they used their gallbladder instead of the appendix. That doesn't make it wrong. I'm sure people have had that done, but it's usually when somebody has done something different in the surgical procedure that people don't really care for that. For women, it makes it much easier for catheterization. For men, some men with a retracted penis, or maybe who don't have quite as good a hand function, have had that surgery, and the reports have been that they've been pleased with it. So again, it's looking at the risk imbalances for you, and the big plus that I know of is the convenience factor. But you need to think about your respiratory status. If you have the hand control, that you would be able to do the catheterization once you had the surgery. If you're having it the surgery because maybe your attendant finds it difficult to catheterize you, that probably would not be a reason enough for me to consider that, but maybe it is for you. So, think about all these things. Surgery is always a risky procedure. If you are a well-bodied person, there's risks that go along with surgery. If you have a spinal cord injury, there's a little bit more risk, but you need to think about what the risk and benefits would be for you to have that surgery. So I wish you well on that, and we'll see how that goes. So if you would like to email me anonymously and discuss more, that would be fine. So, I'll wish you well on that one. So, okay, here we have a person that's having some bowel problems. It says, how can I get in the water when I am totally incontinent? They have a pool at their house and haven't been able to use it for years. That's too bad. Oh, okay. Is there incomplete paraplegia? And okay, so he wants to do his pool. All right. So this is the thing with the pool. We have a lot of people who do aquatic therapy, and they are incontinent because of their spinal cord injury, but they control their continence with bowel and bladder programs. So they're not continent on their own, but so technically they're incontinent, but their bowel and bladder's incontinency is controlled. So that's the people who use the pool, and they are technically incontinent. And so I think I'm on the same thought process as you. So usually those people will stick to their normal bowel program, and if they don't have any incontinencies in between, they can go ahead and get in the pool. Generally what will happen is people will use adult diapers or adult swimming diapers, incontinence pads to participate in the pool, that men might wear an external catheter to contain urine if they don't catheterize, but they have some kind of containment mechanism. There is a thing that you can get for bowel incontinence, and if that's a particular problem for you because of some kind of additional bowel problem, it sounds like you might have, there is a bowel bag that you can buy that just is it has a little taped area that goes right over the anal opening, and then there's a little bag that is attached. Sometimes people wear these if they're worried about incontinency, like if they're going to a social engagement, or maybe they're going to work and they don't feel confident about their bowel program, or they have some kind of bowel problem. And so they'll wear these bags. You can get them, actually you can probably order them through your drugstore. I can't think that I've ever seen them on the shelf at the Walgreens. But you can easily, I'm sure you can order them from Walgreens or CVS or Costco or any kind of place that sells medical equipment. They're not uncommon. They're very, very common. And so people will normally do something like that so they can get in the pool. For you female, you would not necessarily want to wear an internal catheter because the bacteria from the pool or the chlorine could just creep right up that around the outside of that catheter, causing more trouble. But what people will normally do is they'll drain their bladder, make sure it's completely empty. So do an intermittent cath before they get into the pool so that it's their bladder's completely empty. And then wear a bowel bag, and then they'll go in, or wear one of those adult pads in the pool. So we have a lot of people who are incontinent that go into the pool, but it's contained. So you see, it's a little bit different. And then they're having a problem also with their foot curling up. So how can I take care of that? Well, that is going to be spasticity that is probably driving that foot to curl up, because our feet, our arms, every part of our body, our muscles are based on a balance and counterbalance system. So we have one muscle that will pull, and we have another muscle that will push. So we have one muscle that pulls our feet down, like you're describing, curling our toes under our foot. We have another muscle that will pull the foot up, pull the toes up. And so the muscles that pull the limbs towards us are generally normally stronger than the ones that pull our body parts away from us. So it sounds like that muscle is just getting stronger. So the first thing to do would be to range out your foot. You have to do this several times during the day, but to range out that foot to try to get that to become flat. You can talk to your healthcare professional about having some physical therapy so they can show you how to get that foot really relaxed. You want to get on this before it gets too tight and it's locked in a permanent contracture. So you want to be able, while you can still move your joints, to be able to move those up. You want to do it with both feet, because even though it's only curling up on the one foot, the other foot is going to be doing the similar thing soon. So you want to be doing both feet, ankles, knees, making sure that you have the good range of motion up into your hips. You have a low-level injury, so you want to be sure and move all those body parts. So be sure and you can start ranging your foot now just very gently. You don't want to push too hard in case something is too tight, but very gently, and then range it out, and then talk to your healthcare professional about either doing some range with therapy. You might need a splint to keep that foot in position. they might be able to, now this is, I don't know anything about your case, but I'm just going to list all the possibilities I can possibly think of. You might need to take some medication for spasticity. You might be able to bypass that going through your whole body, and they might be able to do a little Botox in your foot, which that can release the muscle that's pulling that foot down towards you just a little bit so that your foot can become flat. There's all kinds of different interventions that you can try. They might recommend those moon boots or those positioning boots for your foot at night, so it keeps your foot in the straight position. It depends on what the cause of that curl is. More than likely it's spasticity, so it depends on what the cause of that is in your particular case, so that will dictate the treatments, but there are a lot of treatments for that. So when you talk to someone about that, they'll be able to guide you on your particular case further. But those are just some options that I know. There's if you're having problems with, if it goes up into your ankle and you start having some foot drops, there's some splints, and there's also just a little ankle cuff that you can wear on a pair of tennis shoes. So the ankle cuff, it's just a little piece of felt Velcro that goes around your ankle, but you can attach that to the ties on your athletic shoes, so that will help pull your foot up if that's more in your ankle. Sounds like this is more down in your toes, and so you just need to keep those toes flat in some way, so you need to strengthen the muscle that's going to pull that foot back up, because the one that's pulling it down towards you is overpowering that. So there's a lot of options for you there, Pearl, so good. That's good. Okay, here's a person that's C6 who's has maybe an augmented bladder, and they're doing intermittent cath through their belly button. I'd like to be independent with my bowel program due to AD issues, and they're looking for other people who are doing this. And so at C6, there are inserters for your suppository, or there's also a device that you can use to help with digital stimulation. So if you're worried about bowel evacuation, you should be able to do that. There should be some devices that your OT should be able to prescribe, your occupational therapist should be able to get for you. That should help you with the independence in the bowel program. Let's see. Oh, the lady with the toes that are curling, she's on her baclofen, TID. Well, there we go. So, Pearl, what you need to do is start ranging that. So the baclofen will help loosen that spasm and then range that foot out to keep your foot flat. I don't know what kind of shoes you wear. Some people don't wear shoes. Some people wear house slippers. At your level of injury, I would suspect that you wear shoes, but make sure you wear flat, supportive shoes, more than those really cute ballerina flats that I just love so much. But I tend to wear during the day my athletic shoes just because they have the support that I need just to get through my day, and they're cushiony and comfortable, and they will keep your feet a little bit more secure. And then wear your cute little ballet shoes when you just, like are going out on a special occasion or something. Okay, here's a person who keeps breaking his back at T8 and T9, which is affecting his lungs. Is there any way I can prevent the bones from breaking in the same spot and help my breathing? Well, Kevin, repeated fractures, as you know, are not good. And so you need to speak with your healthcare professional to see what's going on, why that's happening. I hope that you have had a bone density test to see what's going on. Maybe your density is not, the minerals are not strong enough in that particular area. If you have had people who have sometimes had surgery on their back and they've had stabilizer rods put in there, sometimes that stabilizes the place where an original fracture was, but either at the top of the rod or the bottom of the rod becomes weaker because those vertebrae are now overdoing the work of that one vertebrae that was stabilized. So that at that level could be quite a problem, especially as it's affecting your respiratory because it causes you probably to lean forward and makes it more difficult for you to breathe. So it might be that a brace of some kind might be helpful for you. Now, maybe you have tried those have tried a brace before, and we all know they're hot. They're not very nice looking. There's just, they're a needed necessity, but there's, people don't really have too much to say about them. They're that solid plastic, and they get very sweaty, and they're uncomfortable, and the edges rub up against your skin. But there's a whole lot of new splints and braces that are being developed with these 3D printers that are more lightweight, they're more functional, they fit more towards your body, even though those other ones are they make the plastic mold and then they make the splint from the plastic mold. But these 3D braces, 3D manufactured braces are much lighter, much more user-friendly, much more comfortable. They have a completely different pattern to them, so you don't get that hot, sweaty feeling, and they aren't this big bulky thing underneath your clothes. So if you've had that before, if you've had a brace before, don't be fearful and think, oh, I don't want to go back to that, because you probably won't go back to that. You can get one of these 3D ones, and they say they're much cheaper. Now, I have not really seen anybody get difference in pricing. I have seen some experimental ones. I've seen them advertised, and they certainly are much less in price, but I don't think that they're available quite everywhere yet. But anyway, think about one of those, because that, I think, will be the thing, and it will help you maintain your upright position. So that might be the thing. So Pearl is wearing AFOs, and that's, oh, yeah, she's wearing New Balance. I miss my mocks. Oh, yeah, Pearl moccasins are the best. Yeah, that's kind of a tough one, but check with your doctor, because maybe a little baclofen in that muscle that's curling your toes under, that might be just the ticket, and you might be able to drop some of your baclofen. I'm not sure about that. If you have spasms all over, if your muscles are in spasms in both legs and all over, it won't work that way. But if it's just in that one foot, that might help. Let's see. Here's a person that's been using 2 tablespoons of lactose every night, and then the magic bullet the next morning. After 20 years now, I'm experiencing severe bloating and wound up in the ER with severe stomach pain. I'm now trying a different drug and not having any good evacuations. Are there any suggestions? The magic bullet is just so very fine. So many people like that, and 20 years. It's probably not necessarily your bowel program, but your bowel that is now 20 years older. And that's, again, like our person who said in the beginning with the Postpolio, is that, the aging process catches up with us. So you might want to try, if you're having the bloating, it's probably not maybe the magic bullet. I'm just kind of surmising this in my head, because that only works in the lower bowel. It might be the lactulose. You might need to try a different fiber additive. Once you have a bowel program that's well established for 20 years, it is a little more challenging to change it, but it is not at all impossible. So it will take a little bit more effort than a week or two, but try some of the different fiber additives and see if that would help. Another thing that people are using are that is that mini enema. You don't want to do a full enema, but the mini enema that works in the lower bowel, like your magic bullet, that might be something that you can try, but you might just want to try your different fiber and see if that works, because we don't want you to have that stomach pain. So see how any of that stuff goes, and just keep trying. And if you ever want to write in or look for other suggestions, and there's just a wealth of bowel preparations out there that might help. So it could be that lactulose is doing something that's puffing up your bowel, because that the magic bullet would only be working in the lower bowel. So I suspect that's the area where the problem is. But that's my tip. You can take that to your healthcare professional and see what they have to say. Being that I don't know your case directly, but that would be just my summarization about that. Well, I see that we are up at the top of the hour. So with that, don't forget that Nurse Linda is on the web every Wednesday night. If you do send an email, I try to answer them as soon as I possibly can. But anyway, with that, I will see if Julie is with us.
I am.
All right.
And thank you, everyone, for joining us today. And I just want to remind you that this was being recorded and that you can view it on our YouTube channel. And also you can leave questions for Nurse Linda in our community by going to christopherreeve.org/nurse. Thank you all for joining us and for the wonderful questions.
Thank you.